Thank you, Professor Cowie, for joining us. Professor Martin Cowie is a Professor of Cardiology at the Imperial College and at the Brompton Hospital. He's also Trustee of the AF Association and has very kindly agreed to answer some of our many patient inquiries about heart failure. Thank you.
No problem, Trudy. Pleasure.
Right, I will fire away with the questions and await your expert advice. First and foremost, what is heart failure and what does it actually mean? Because for many it sounds very frightening, scary. What causes it and what are the main symptoms of heart failure?
Yeah, so heart failure does sound quite a scary thing. It makes you think that your heart's about to stop, and that's not the case. It's just the medical term that's used when the heart's not pumping as strongly as it should do. And what you might notice in your day-to-day life is you're a bit more out of puff when you're doing your normal activity. Particularly, you might notice it going up the stairs or going up a slight incline. That can be one clue as to developing heart failure. Or some people actually notice fluid building up either in the tummy or in the legs, and that's just the body responding to the heart not pumping as strongly as it used to do. And the most important thing, of course, is not to ignore the symptoms, but to make sure that a doctor checks you out to see whether you do have this problem or not, and then answering the question, what has caused the heart to not pump so well? And there's a variety of different reasons, and they have to be sorted out, and then you can have a clear plan of how to start making you feel better.
And can heart failure, is it mainly affecting the elderly or any age?
It can affect you at any age, and of course some children are born with heart problems that can lead to heart failure, even in the womb or in the early days after birth. But most people with heart failure tend to develop it after retirement age, so the risk goes up as time goes on, but it can happen at any age. So the important thing is if you have these symptoms of breathlessness or fluid building up, you get it checked out, whatever age you are. Obviously, if you're older, if you've got a history of high blood pressure or a heart attack in the past, then particularly you should pay attention to any such symptoms.
And you mentioned children. Is heart failure genetic?
Well, in addition to children who are born with heart defects, and of course, sometimes we don't know why that's happened, you can have a family history of heart failure. And we know increasingly that there are some genes that you might inherit which can influence the risk of you developing heart failure. Now, some of these genes are very powerful, so nearly half of people in one family might develop heart failure in older life, but other genes are very much milder, and it depends a lot as to what happens. And sometimes stress on your heart through life might make those genes more important. So it's quite a complex picture, but definitely if there's a history of heart failure in your family, you should mention that to your doctor, just in case that's relevant. For most people though, it's things that you've developed through life, such as long-term impact of high blood pressure. You might have developed atrial fibrillation, which has tripped your heart into heart failure, or you've had a heart attack in the past, so that's damaged your heart. So for most people it's not genetic, but for some it can be.
You mentioned atrial fibrillation. So atrial fibrillation can trigger heart failure, but can heart failure trigger atrial fibrillation?
Indeed, it's a good point. It's like the chicken and the egg. So certainly we know from lots of different studies that if you have atrial fibrillation, there is a slightly increased risk of you developing heart failure as time goes on. It's not inevitable though, by any means, but some people do develop heart failure. So if you do start to become breathless or notice fluid building up, and you know you have atrial fibrillation, don't ignore it and get it checked out. But also if you've got heart failure in your normal rhythm, we do know that about 10% of people will flip into atrial fibrillation each year. So it's very important. And some textbooks say that everybody will notice if they flip into atrial fibrillation. This is just not true. Some people are quite unaware that their pulse is irregular. They don't have any palpitation. They don't feel their heart thumping, etc. And it's only when somebody feels their pulse or does an ECG it's picked up. So very important if you have heart failure to have a regular check. NICE recommends every 6 months with your GP or with a specialist nurse or with your consultant. So always keep an eye on the ball is what I say to my colleagues with people with atrial fibrillation or with heart failure.
And are there any things you can do in everyday life to improve your health and to try and avoid heart failure or to manage heart failure better? exercise, diet, etc.
Yes, no, indeed. There are ways you can help protect your heart so that if you do develop heart failure, it's at older age than it would have been. And, you know, you won't be surprised by the things I say. Don't start smoking. If you do start smoking, get all the help you can to stop as soon as possible. It's very addictive. Get high blood pressure picked up soon, and there's lots of efforts to do that. Get it treated properly. And also generally healthy lifestyle in terms of diet and exercise is important. We do know that if you become overweight, that increases the risk of heart failure and other problems, including atrial fibrillation. So it's important to have those kind of investments in your future heart health from as early an age as possible. So something I say both to people, but also to parents with their kids and teenagers. I know it's always hard, but trying to encourage those healthy lifestyle choices really pays dividends down the line.
And so it is fine to exercise.
Absolutely fine. In fact, even with people with heart failure, we say to them it's important that you do exercise. Otherwise, you add being unfit on top of having heart failure, and that makes a vicious cycle where you do less and less, become less and less fit and more frail. So once the symptoms are controlled, and that's relatively easy to do for most patients, we encourage people to exercise. 3 times a week is what the official recommendation is, for half an hour, to the point of being slightly out of puff, slightly sweaty. But if you'd like to do it more, even better. Every day, I think, is important. And then even if you have severe heart failure and you're confined to your home and you're very breathless, you can still do activities at home, even in your chair, to keep up your muscle strength. So it's not all just about running around and doing marathons. It's just about normal activity and also keeping your muscle strength up. And even chair-based exercise can be very helpful, particularly as you get older.
Are there any foods or drinks that I should avoid, or maybe I should increase to improve the heart failure?
I think for heart failure, if you've got very severe heart failure and it's difficult to control, then the amount of salt in your diet can be crucially important. The more salt you take, the more fluid you retain, the more difficult it is to control your breathlessness. But that's only for a very small proportion of people with heart failure. For most people, we say it's just a normal, heart-healthy diet that you should take. I think in the longer term, though, Trudy, in trying to reduce the risk of heart failure, don't take too many calories, do some exercise, don't just slowly put on weight as you get older. That will also help you reduce the risk of heart failure. And also it's very important, and as I say with my patients, you know, don't beat yourself up. If you take some foods that actually you think is a bad food, there's no such thing really. It's about the balance you have in your diet. And you know, food is an enormous pleasure for most of us. So it's important not to restrict yourself too strictly on that. Final point on that, of course, you said anything I should avoid. Heavy alcohol consumption. It's not great if you have heart failure, and also it can, particularly if it's very heavy, cause heart failure. So I think alcohol in moderation is okay, but don't take too much. And the British way, of course, is to binge on drinking, particularly at young ages. And I think lots of adverse effects of that on the heart, your liver, all sorts of things. So a little of that is okay, but not too much.
So we've talked about what the patient can do to help themselves, but what can you do to treat the patient with heart failure? What are there?
I think it's really important that doctors and other healthcare professionals treat new symptoms seriously. So if somebody is breathless, don't say it's old age. Don't say, oh, well, what do you expect? Think, well, what is going on here? Are we dealing with a diagnosis of heart failure? And if you suspect it, we need to do the tests. And the tests are very straightforward nowadays. There's a blood test looking for a hormone the heart releases if it's under strain. Very useful test, very simple to do. GP can do it, NICE recommends it. If it's high, it could well be heart failure, and you should be sent along to see a specialist and have a sound wave scan, an echocardiogram of your heart. If that blood test is absolutely normal, it's unlikely to be heart failure, and the doctor can think of other things. So I think the key thing is diagnose early. Same as for atrial fibrillation. Don't ignore things. Get it diagnosed properly, and then the treatments open up from there. And for the vast majority of people with heart failure, we can get people back to a very good quality of life. So a whole range of different medications we can use. Lots of trials over the years, lots of success in this area. It's really transformed in the last 10 or 15 years. And for some people, they may need a defibrillator or a special pacemaker, and that can be organized as well. So there's a whole range of options, but the important thing, the patient, the family, and the medical people, nursing people round about, to take this seriously, get investigated, and a clear plan moving forward.
Thank you. And then finally, you mentioned that it's more common in the elderly, and sadly often the elderly are living alone. Do you have any tips or advice for someone living alone with heart failure?
Yes, I think it's really important to understand what heart failure is, to have a good discussion with your doctor about what it means for you, what you can and can't do, and get a plan. But also, if things get worse, then you know who to call, how to get help, and how to get advice. A lot of people with heart failure, their fluid retention builds up, their feet get more and more swollen, and they're not really noticing, or they're hoping it goes away. So it's really important not to ignore symptoms and to know who to turn to. And the great thing in the UK now is that we have a whole network of specialist nurses that are really focused on heart failure. Sometimes they work in primary care, sometimes in hospitals, and they should be easy enough to get access to help you. So pay attention to your symptoms, get advice early. And the other thing is involve your network of people. You may live on your own, but I bet you've got friends, I bet you've got some family around. Make sure they know what the problems are, what the issues might be, and get them to help you as well. So I think that's really important for doctors as well, to realize it's not just the person with the condition, it's the whole family that can be involved in that. And often they want to be involved and to be helpful. And the great thing that we've seen in recent times, there have been many bad things with COVID, but one of the good things is it's really opened people's eyes up to the fact you can use digital technology, telephone consultation, video consultation to help people. They don't have to wait for a face-to-face appointment with somebody. So I think there is a network to help support people with heart failure in the UK, and it's very important to use that.
Thank you, Professor Cowie. And of course, the Arrhythmia Alliance has patient resources on heart failure. And also under our COVID section, there are specific questions relating to heart failure. So thank you very much to Professor Martin Cowie.
Pleasure.